For decades, these hospitals stood at the center of their communities. They treated the sick, comforted families, and saved thousands of lives. Today, they are silent, abandoned, forgotten, left behind by the city they once served. In this film, we explore 5 hospitals in Los Angeles and the quiet story of how they disappeared. These hospitals were not just buildings. They were where working families went in emergencies, where children were born, where lives were saved. In a growing city like Los Angeles, they represented hope and stability for generations of residents. But as society shifted, economic pressures and changing priorities took their toll. This is the story of how vital community lifelines faded away. Opened in 1905 in Boyle Heights as the Santa Fe Coastlines Hospital, funded by the Santa Fe Railroad Employees Hospital Association for railroad workers and their families. It even provided fresh farm produce from its own gardens and livestock. By the mid-20th century, after a 1924 rebuild in Mission Revival style, it expanded to 150 beds by 1937 when renamed Linda Vista Community Hospital. It gained a strong reputation for treating community patients with major additions up to 1939. For many working-class families, this was where emergencies were handled and lives were preserved. But by the late 1970s, declines set in from falling railroad usage, the shift to managed care, and handling high-risk cases like gunshot wounds amid changing Boyle Heights demographics. Uninsured patients surged. In 1989, emergency care was forced to close amid rising death rates and severe cost cuts. The hospital shut down fully in 1991 due to financial strain and an exodus of doctors. No major public protests occurred, but it quickly became a site for haunted film shoots like Outbreak. Today, after sitting abandoned for decades and listed on the National Register of Historic Places in 2006, it was redeveloped into 120 low-income senior apartments by 2015, preserving its historic structures. The halls are quiet now, repurposed but forever changed. Traces back to early 1900s county operations, but primarily refers to the mothballed Lincoln Heights Tower. Funded by LA County, it served indigent and general patients across the region. It operated as a major county facility for decades, with its iconic 19-story Art Deco building at the heart of LA's public health system. For generations, it was a beacon for those in need, handling everything from routine care to major crises. But in the 2000s, it faced asbestos issues, increasing vacancy, and broader county health budget crises. Mostly vacant since around 2010, though parts were used for wellness and training programs. Today, a $250 million redevelopment is underway for affordable and homeless housing, with Phase 1 for recuperative care opening in 2022. The tower stands as a reminder of past public service, now being reborn. Opened in 1933 as a 165-bed non-profit hospital, likely church-affiliated at first, serving Northeast Pasadena residents. It thrived for 61 years alongside nearby Huntington Hospital, routinely filling 70 to 75 beds and becoming a key local landmark with its golden cupula. For the community, it was a trusted place for care, standing as a symbol of reliability. But post-1980s, it struggled with outdated facilities, competition from larger rivals, and low occupancy due to managed care shifts. It closed in April 2002 after stopping non-emergency admissions in January, chiding financial woes from parent company Tenet Healthcare, leaving Pasadena with only one full hospital. Today, sold to Caltech in 2003 and then to Denley Investments in 2007, it remains abandoned and used as a filming site, protected as a historic landmark that prevents demolition. The structure endures, but silent and unused.
Hospital 4, Rancho Los Amigos National Rehabilitation Center, Downey. Originated in 1888 as the LA County Poor Farm on 124 acres. County funded to provide work and medical care for the indigent, elderly, disabled, and homeless. Rancho Los Amigos, an abandoned sanatorium in Downey, CA. It expanded to 540 acres by the late 1920s with new wards and a powerhouse, becoming a polio rehabilitation center post-1951 and booming in services. For thousands, it offered not just treatment but a self-sustaining community. But during the Great Depression, funding cuts hit amid rising residents. By 2003, a board vote considered full closure due to county budget gaps. No full closure occurred. The active North Campus was consolidated and renovated with a $418 million project called Rancho Rising 2020. The South Campus structures were mothballed. Today, the South Campus, Poor Farm remnants, sits abandoned and vandalized, with 2017 fires destroying buildings. Redevelopment EIR was certified in 2021. The ruins whisper of a forgotten era. Hospital 5, Hollydale, Pacific Colony, LA County Poor Farm, Downey. The same origins as Rancho in 1888 as the LA County Poor Farm, funded by county bonds for poor and disabled individuals through farm labor. Later known as Pacific Colony for developmental disabilities, it was town-like with a post office and zoo. It grew hugely, housing thousands by the 1950s after annexation into Downey, proving a successful self-sustaining model for care. For its residents, it provided structure, work, and community in challenging times. But by the 1980s, it fell into disrepair amid deinstitutionalization and rising costs. Phased out in the 1980s as the broader Rancho shifted focus, specific Hollydale mental facilities were shuttered. Today, the abandoned South Campus ruins, known for Downey asylum legends, include a 2006 discovery of mummified remains. It's slated for redevelopment. The different neighborhoods, eerie and different patients. Same ending. Funding cuts from economic shifts, privatization pressures, changing societal priorities that left public health behind. From railroad declines to budget crises and managed care, these hospitals fell victim to forces beyond their control, highlighting how vulnerable even essential services can be. These buildings once represented care and community. Their decline reminds us that healthcare is not permanent. It must be protected. As Los Angeles continues to evolve, these forgotten places serve as a cautionary tale about what happens when priorities shift away from the people who need them most. If you value stories like this, consider subscribing. Thanks for watching.